Pharmacists say only 20 out of 100 people test for malaria before treatment.
The remaining 80 only do so after being persuaded by pharmacists to test for the parasite.
According to pharmacists, malaria test is common in pharmacy shops, though many prefer to buy malaria drugs straight away than testing for the disease. Health experts have warned against medication without testing for parasites in the blood of patients. According to the National Malaria Control Program, 10 million cases of malaria was recorded last year, but not all of them were tested for before medication. The Minister of Health, Alex Segbefia, expressed concern at the trend and stressed on the need to get tested before treatment.
We lost a lot of people initially when meningitis came because of misdiagnosis. Now, if you don't test and you have a fever and you think that, look, it's malaria, and then you later, when you're getting worse, go to the hospital, it may be too late to save you from what you actually have. So testing is actually key. Some of the tests can be quite quick. So if they are able to just give you a pinprick and take a sample of your blood, and within a few moments it can say, give you some indication of what you have, or whether it's malaria or not, then you can also then receive the right treatment early enough.
Pharmacist Kwesi Nyantechi warned against diagnosing every symptom such as headache, cold and fever as malaria. Test kits are now common in pharmacies and sells between 3 and 9 Ghana cedis. The Public Health Director of the Ghana Health Services, Dr. Bedu Sarkodie, said the Ghana Health Service is putting mechanisms in place to ensure that pharmacy shops in the country, especially in rural areas, have malaria test kits.
You test, you treat and track, and that is the mechanism now. We are doing best to get the rapid diagnostic test, which is the point of care test for our health facilities, even at the lower level. And even later you suggest that community do best to have the facility so that if you think that you are having a febrile illness, it's mild and it could be malaria, just test first before you start taking the requisite anti-malaria treatment which is readily available.
This, he believes, will reduce the wrongful treatment of malaria.